Welcome to everybody who's joining. We've got quite a big group today, so it might just take a couple of minutes to have people filter in through the waiting room. So we'll start at a couple of minutes past. Welcome everybody. I can see the numbers are still ticking up on the attendees list, but we will make a start. Very warm welcome on a chilly day. Really pleased to have you all here with us for the November VAMHN time webinar. I'll just do a little bit of housekeeping before I do introduction. So we have this set up as a Zoom webinar, which means that you will have been automatically muted and cameras off. So if you can only see myself and Síofra at the moment, don't worry, that's what you're meant to be seeing. Hopefully you can also see the slides. It does mean that you won't be able to raise your hand to ask a question, but the questions are a really important part of what we're doing today. We ask our speakers to speak for around 20 minutes, really focusing on bringing out the real-world implications of their findings for policy, for practice, service provision, research. So we ask that you use the Q&A box that's just down at the bottom of your screen to submit questions. I am able to see those and I'll be putting those to Síofra in the question and answer session at the end of today's talk. If we're not able to get through all of them, I apologise in advance. Please do send them through and I will try and get through as many as I can. We do have a chat box as well. If you use that to introduce yourselves and to share any links and resources, that can be really helpful. We find the webinar is being recorded. We will post the recording to our website and we will send a link to that to everybody who's been signed up today. We'll also be making a PDF copy of the slides available. So lots of resources. You can also follow us on Twitter and Blue Sky and LinkedIn, where we'll be sharing some additional resources that Síofra has sent to us that are relevant to her talk. So that's the housekeeping done. I'm delighted to welcome Síofra, who is a trauma survivor researcher working as a research associate at King's College London. Her research focuses on transforming health system responses to interpersonal violence and particularly complex trauma and sexual violence. She's really interested in using and developing creative and trauma-sensitive methods to engage with lived experience perspectives. And she has expertise in trauma-informed approaches, violence against women and girls, qualitative research, and meaningfully involving people with lived experience of violence, trauma, and abuse. She is so passionate about ensuring research has real-world impact impact and is meaningful to those who are affected by and use it. So we're absolutely delighted to have Síofra here to speak to us today, and she'll be talking on Counteract the Gaslighting, what women survivors of intimate partner sexual violence need from service providers, which I understand is research conducted in an Australian context, but Síofra's really going to pull out what that means for a UK setting also. So Síofra, thank you so much. I'm going to turn my video off now as well and enjoy listening to you. Thank you.
Thanks so much, Shan. Thanks for having me. I'm really delighted to be here and to talk to you about this. And as Shan mentioned, the research was carried out in Australia, but it's, Australia and the UK are pretty similar in terms of service provision on a kind of high level, and it's a high income country, and so it's comparable, but I'll pull out those kind of the key messages for the UK, because I think everyone on the call is probably in the UK. And I just wanted to say as well, so the paper or the research focuses on what intimate partner sexual violence survivors needed from service providers in their own words. But there will be mentions of intimate partner sexual violence because I'm going to show you some quotes. So just to be aware of that as a kind of content warning. They do refer to kind of instances of sexual violence from partners. It's not a huge amount, but it is there. So can I have the next slide, please, Flavia? I just very briefly wanted to kind of tell you, so Shan already did a lovely introduction, so I won't kind of add to that, but just to kind of let you know who's speaking to you. So yes, I am a trauma survivor researcher. I have lived experience of the things that I research, and the kind of my passion, I guess, for this field came from that, as well as my working in the third sector, so in a rape crisis centre on the National Sexual Violence Helpline. I've done a lot of work looking at kind of what does ethical research look like from the perspectives of survivors, and trying to improve health care responses, so particularly mental health and maternity care responses as well. And I've put the logo there for the Restore Centre of Research Excellence, because the person who leads that centre, which is in Melbourne, was a collaborator on this work. So that's Dr. Laura Tarzia. So if anyone's really interested in looking at, it's just launched, but there'll be some really fantastic research about improving health, particularly health sector responses. Can I have the next slide, please? So I'm gonna not spend a huge amount of time on this, but I wanted to pull out kind of very briefly the kind of unique context of intimate partner sexual violence. I'm sure everyone on this call is familiar with this kind of broad area of research, but I just wanted to kind of make sure we're on the same page. So we know sexual violence is really common among women. Quite a lot of sexual violence perpetrated against adult women is perpetrated by a partner or ex-partner. And also what I think there's a lot of practice-based knowledge in this, but not enough in the academic world at all, around intersections between psychological abuse and psychological tactics of controlling and kind of asserting power over survivors by perpetrators, and sexual violence. Quite often in research, what we talk about is physical, kind of co-occurring physical violence and sexual violence, but actually it's quite important for this and what I'm about to talk about, that we all I kind of mentioned that a lot of intimate partner sexual violence is really subtle and can, on surface, it often doesn't involve physical violence and is often much more psychological in nature. And that's the model I'm showing you there is from a paper by Laura Tarzia and someone called Kelsey Hegarty, where they talk about some of those relationships, which I won't go into now, but if you're interested, you can look that up. Next slide, please. So I'll just talk to you briefly about the kind of context of the research. So what I'm going to talk to you about today is a sub-analysis, so analysis of open-ended text responses to a survey. So there's quite a large survey called the Voices survey, and I can send a link. I can put a link into the chat about kind of all the reports that came out of that survey. But what we did was we looked at it was a survey of looking at intimate partner violence and sexual violence experiences, so prevalence and lots of different things. And we looked at specifically the women who had reported in the survey that they had experienced intimate partner sexual violence, and we defined that very broadly. So it included things like being forced to watch pornography, kind of more subtle kind of behaviours that are not always included in definitions of intimate partner sexual violence. So not just focusing on sexual assault and rape, but looking at the kind of the broad spectrum of behaviours. So it's quite broadly defined. And then, so that was over around 400 women. And then we looked specifically at a kind of subset of that, and I'll explain that more in a minute. But in total, we had 37 women whose responses we could analyse. And I just wanted to tell you a little bit about who these women were, and what the context of the research is. So they pretty much all of them were young. Most were born in Australia. Most had English as a first language. Most lived in a metropolitan area, so city, and most had children as well, and completed year 12. So that's up to schooling up to around age 18. Just over half had a university degree, and a similar amount were healthcare card holders, which indicates that they were receiving some sort of benefits. A similar amount were employed, and also a similar amount found their income difficult to manage, which makes sense, because I imagine there's relationships between that and being a healthcare card holder. I also want to say, we only asked about the sex of the current partners. So out of the women who did have current partners, which was 15, most had a male partner. And the findings that I'll talk to today pretty much kind of speak to heterosexual relationships, because there's a lot of kind of talk about notions of kind of masculinity and femininity. So in terms of relevance of this research, I just want to make it really clear. So all the participants identified as women, they were speaking mostly about male partners and drawing on kind of their experiences in that context. I still think it has relevance for different relationship structures, and I'll talk to you about that more at the end. But I wanted to make that really transparent. So can I have the next slide, please? We defined service providers really broadly. And we did ask women specifically about who they sought support from and who they spoke to, but the numbers just weren't big enough to look at that in any meaningful way for this. But just for context, we asked women about pretty much anyone that they might go to talk about intimate partner sexual violence. So it wasn't just focused on healthcare, which often research is. So for anyone who's on the call who's working outside of a healthcare context, maybe you're working in local government or in the third sector in a charity, this has relevance for you. We kind of included those services in women's responses. So that included religious leaders as well. So a really kind of broad definition of service providers. The next slide, please. So the questions that women responded to that we analysed are on the screen now. So there were 2 questions that women responded to in the first one. So this was after they had answered a number of questions about the different behaviours that they'd experienced from a partner or ex-partner, and different kinds of sexual violence experiences they had as well, and all sorts of different things. And then there were these 2 open-ended questions. One of them was asking, what do you wish providers had done differently after speaking to them about your partner's behaviours? And what do you wish providers had done differently after speaking to them about unwanted sexual encounters? So they weren't asked specifically about intimate partner sexual violence. And because I came in later, this was a kind of small little project that I did during my PhD. The way we addressed this was we only looked at responses where women specifically mentioned sexual violence from a partner. And we did that to make sure that the findings were just more rigorous, because we could have looked at the 400 or so women who'd experienced intimate partner sexual violence, but we wouldn't have known that what they wanted was actually related to their unique or specific needs around experiencing sexual violence from a partner. And we really wanted to draw that out in the study. So I hope that makes sense, but I'm really happy to answer questions on that if it's not clear. So next slide, please. I'm not going to go talk in depth about the method and things like that, because I want to have time to talk to you about the findings, which is the next slide after this. But I just wanted to get across that we built in a lot of rigor in how we came to the patterns or the themes that I'm going to talk to you about now in a minute. So there was I kind of read and reread responses several times, and then I coded them. So I kind of labeled what women were saying. And then from that, we developed kind of an understanding of what are the kind of themes, what are the patterns, what's coming out that's important for women. And my two colleagues, so Liz and Laura, whose names were on the first slide, they were there as, I led on this, and they were there as kind of critical friends, making sure that what I was seeing, they were also seeing in the quotes from survivors, because that's really important that, for example, Now I have some experiences and I can relate to this kind of thing. I think all researchers can relate in some way to the things that we're researching, even if it's just because we have some sort of vested interest. So it's really important that we have people around us who can help make sure that we stay really grounded in the data, and that's what they were there for. So next slide, please. So three kind of main themes came out, or we identified, really, is a very active process of identifying themes and generating them. So the first one was, we named each theme as well using a quote from a survivor. So the first theme was called Don't Dismiss It. The second theme was called See the Bigger Picture. And the third theme was called Counteract the Gaslighting. And I'll take you through each of these themes. And I really wanted to, in this talk, I really wanted the quotes from survivors to kind of be the main focal point. So that's how I'm going to kind of talk through them. So can I have the next slide, please? So in the first theme, Don't Dismiss It, what was really a kind of overarching message was that intimate partner sexual violence is really, really invisible. So it was kind of not really considered a form of sexual violence by service providers based on what women were saying in their responses. And it was also not really considered a form of intimate partner violence. It was often just seen as something that was due to like relationship conflict or differences in libido, or kind of stereotypes about women and about men. So this, as you can see, this quote here, and I'll read it out to you. This woman said, "Service providers need to realize that my husband asking for sex repeatedly when I didn't want it might be a cause for concern, rather than just try to find ways to increase my sex drive." So she's really pulling out this kind of assumption here around there being something wrong with her because she wasn't enjoying what her husband was doing, rather than the service provider looking at what her husband was doing and looking at that as a problem. So locating the problem within her rather than within him. Next slide, please. So the quote says, "Professionals need to stop shaming victims, including the idea that it was okay because it was my partner." So again, speaking to the relationship context here, this kind of idea of, and this came out quite strongly, this idea that consent is just presumed in a relationship, and how that had relationships with kind of this idea that women, there was a duty for women to be kind of sexually available to their partners, or that men, it's okay from, like, that's just something that's expected. So yeah, that's what this quote kind of speaks to, this kind of the relationship context made it a really invisible form of sexual violence. It just wasn't seen. So what generally came out was that women were believed, like service providers seemed to believe that these things were happening, but they just didn't think it was that serious. So we often talk in the sexual violence literature about women not being believed. A lot of these women were believed in a sense, it just wasn't seen as serious. So the next slide, please. This participant said, "My ex-partner would threaten to kill himself if I wouldn't have sex with him. None of the professionals that I've spoken to seem to think that's a big issue." So she's really speaking to here the kind of the psychological tactics that perpetrators used and how effective those were, and how that wasn't, so what wasn't being seen here was that this threatening to kill himself was a way to coerce her into sex, and that wasn't being seen as a kind of a tactic. And I think it's really important to recognize just that we talk generally about the lack of physical violence. If there's no physical violence, it's not real rape, those kinds of things, which are important. But there's also something specific about the kind of relationship context that makes it even harder to define this as sexual violence and to articulate it as such. So that brings me to my next theme. So can I have the next slide, please? The next theme was, we called it See the Bigger Picture, which was a quote. And this was all about survivors really wanting service providers to understand the impact of their partner's behaviors on them and look at it as a pattern and as a part of a bigger kind of pattern of abuse or control, rather than focusing in on individual incidents. So this survivor said the intimate partner sexual violence was part of the objectification and reasons for the emotional blackmail. Service providers need to understand that it is part of a bigger picture of controlling behaviors used to demean their partners. Can I have the next slide, please? And this participant said, service providers need to understand that a woman may have difficulty labeling an unwanted sexual encounter as rape or assault, or even unwanted. A woman may indeed yearn for intimacy with her partner, but end up feeling degraded and violated without truly understanding why, particularly if her confidence has been eroded by constant critique. And this is a quote that stayed with me for a long time, because I feel it articulates just so clearly how just how hard it is to label this, to kind of for women to articulate what's going on and to really understand, and how this kind of really confusing, disorientating position that they were in around loving this person and being committed to this person, but also feeling really degraded and violated by what they were doing. And then when they had service providers kind of reinforcing that idea that there's something wrong with this woman rather than her partner's or ex-partner's behaviors, that made it even more confusing and kind of further eroded her confidence and her kind of sense of reality and trust in herself. So next slide, please. And the final theme we named Counteract the Gaslighting. And again, this was a quote. And what this is really getting to is, so we've talked about how difficult it is for women to really understand what's going on. We've talked about the different stereotypes, gender-based stereotypes really, that are weaponized and mobilized, and how service providers can, probably with good intentions, reinforce them when they don't understand what's going on. This is really about wanting something really active from service providers. Women wanted service providers to actively challenge and counteract these stereotypes that they've been talking about. So not just be aware of them and not just acknowledge them, but name them, actively kind of challenge and dismantle them to help survivors understand that this is a form of sexual violence and it isn't okay. So as this quote shows, service providers need to talk about what is not okay. It is not okay to badger your partner into having sex. It is not okay to have sex with them while they're asleep. It is not okay to isolate them if they say no to sex. So really clear, this is what consent is, and this is what consent is not. This is what's okay, and this is what's not okay. And they really strongly wanted that from service providers. And a few also talked, it's outside the scope of this particular research, but a few of them talked about the need for education earlier for everyone, for all young people and children, around what enthusiastic consent is and what healthy relationships are. So yeah, next slide, please. And this quote says a similar thing: educate me about what unwanted sexual encounters are. It was very confusing when they occurred because I thought that it shouldn't occur, because I understood myself to be in a supposedly consenting or loving relationship. So this idea of kind of conflating love and consent, that it just happens in society, and we've seen service providers were kind of reinforcing. And those are the kinds of things that perpetrators will use to invalidate survivors, to facilitate their abuse. So it's really important that when we're working with survivors, and I'm sure lots of people in this room, if not everyone in this room, will know this, we're kind of really aware and our ears kind of prick up when we hear things like that, and we're ready to challenge that. So next slide, please. This is the last quote I'll show you. So this participant said, clearly define what is acceptable and unacceptable behavior of a husband, and how wives are not obliged to live up to their expectations. So a really important point here around shifting the kind of responsibility away from women and survivors and onto perpetrators and onto the society that kind of enables and facilitates and kind of reinforces these messages that make it seem okay for these kinds of sexual experiences to be happening. So can I have the next slide, please? So I wanted to summarize some of the recommendations for you that came directly from the survivors. So these were what's really important to them was that service providers don't make assumptions about the severity of behaviours. Like we've seen, some behaviours were seen as not that bad, or not that, you know, I say that not kind of meaning not that bad, but, you know, they were seen as not serious or not severe, or seen as just a symptom of an unhappy relationship or different priorities in a relationship. What's really important to women is that we listen to the impact of the behaviours on them. Are they feeling degraded, humiliated, afraid, trapped? Are they feeling really confused and disorientated? Those kinds of things. If we listen to that, I think we can hear these experiences for what they really are. They wanted service providers to focus on the pattern of behaviour, so not the individual incidents. And the relationships between intimate partner sexual violence and psychological abuse are really complex. And it wasn't about, this research wasn't about trying to identify those, but just being aware that they can happen together and they're part of a bigger thing. And then finally, really actively naming intimate partner sexual violence for what it is, even when that might be hard to hear, acknowledging the kind of the continuum of behaviours. And also an interesting kind of point that came out in terms of recommendation for further research and potentially for policy developers or evaluations was this idea of universal education, because it was, we only analysed responses from women who had disclosed intimate partner sexual violence. So all of these women had spoken to someone about it. We know that it's so difficult for any survivor to even speak about these experiences to anyone. So this idea of universal education means that everyone has access, is given information and language and sources of support, irrespective of whether they have disclosed or irrespective of whether they're seen to kind of have indicators of abuse. Another thing that came out, and this is my second to last slide, and because I think I'm up for time anyway, there was two questions that we asked. So one was about what women wanted service providers to do differently in response to their partner's behaviours. The other one was about unwanted sexual encounters. Pretty much no one spoke about intimate partner sexual violence in response to the question that asked about partner's behaviours. Most of our responses that we could analyse came from the question that asked specifically about sexual violence. And this is just, you know, it chimes with my own experience, both personal and within the sector, around how difficult it is to talk about sexual violence and how it kind of is really, it's just so, I mean, all of this is so kind of silenced and shamed, but there's something about sexual violence that's really, you need to ask specifically about it, really. So asking about intimate partner violence broadly, probably isn't going to get you disclosures of intimate partner sexual violence. That's what that indicates. And it's not just from this study that I'm saying that, it's kind of my broader knowledge that I bring. But I think it has implications for practice and for service provision and for research as well. And so next slide, please. And that's my final slide. I put a picture of a cat in there because I felt like I needed to see a cat. So I always find those quotes quite difficult to read. And I just, for anyone who's listening who might have found them a bit difficult to read as well, sometimes it's nice to get some endorphins going with a cat. But I also wanted to kind of show, I mean, there was just such a sense of being isolated and alone and not being heard and not being seen. And what I think we want is for survivors to feel really kind of wrapped up and safe and like they're being held and they're being understood. And we didn't get that sense from the responses, and I hope that we can change things so that survivors do get that. But I'll leave it there. Thank you so much for listening, and yeah, thanks.
Síofra, thank you so much for such a thoughtful and nuanced talk. the research that you're presenting. It's so important, and yeah, really grateful to have it presented to them, and give people the chance to ask questions as well about the research. If I can ask people, if you do have questions, if you can put them into the Q&A box. We have about 15 minutes to chat with Síofra. I wondered, Síofra, you mentioned some of the ways in which intimate partner sexual violence is, and the response to it is distinct from other forms of intimate partner violence, or intimate partner violence more broadly. I wonder whether you think what can we learn from existing guidance on responding to intimate partner violence in healthcare settings?
Oh, okay. That's a good. So do you mean kind of like the World Health Organization guidance and those kinds of things?
Yeah, I mean, where there's the World Health Organization have their lives model. There's the nice PH50 guidelines on responding to domestic abuse in healthcare settings. I wonder whether you think whether there are things from that we need to transfer across to our response still.
So things from this research that we need to transfer across to the IPV response.
Things from the broader IPV response that you think are relevant to sexual.
Yes. Well, I think what is often the focus in responding to intimate partner violence is safety planning. And I think that there's definitely something to be said for how sexual violence plays a role in risk. And I mean, I'm not an expert on this, but I'm pretty sure it is a risk factor for things like domestic homicide or like really high risk things. So definitely, if someone becomes aware of somebody experiencing sexual violence in their relationship, that's a really serious form of violence, and it's important to kind of, I guess, consider a person's safety and their risk. But I mean, what seems to be the most important thing is just having empathy and listening, and just really just being kind of a human being in it all, and validating what's going on for somebody. So I think all of those, they'll address that, and the need to kind of be led by women, because what's happening is people are having their control completely taken out of their hands, and it's important that we in our responses kind of reinstate that control as much as we can. But yeah, I definitely think that there are things around kind of safety, and there was a couple of quotes that I didn't put in there where women definitely saw sexual violence as being a really big part of kind of really a big threat to their lives, and a really kind of at a really dangerous point of the relationship, and also just kind of needing to listen and show empathy. I hope that answers your question.
Thank you, that's great. So I have a question from somebody who works in a Red Crisis Centre, and she asks, how can people, for example advocates, push for change and more recognition of sexual violence in relationships among first-line responders like police and healthcare professionals? I work in a rape crisis centre, and I feel a lot of the referrals we get involve a stranger subjecting a survivor to sexual violence, and I wonder how we can ensure that we're supporting all survivors.
That's such a good question. Thank you so much. It's also a really big question. I completely agree with you. I think it comes down to this, these kind of ideas of what rape or what sexual violence should look like, and it often comes down to physical violence as well. In terms of bringing first responders along with us, I think there needs to be a change. So the police, the healthcare system, they're just a microcosm of a broader society that doesn't want to know about things like intimate partner sexual violence, and that delegitimizes or kind of invalidates people who experience violence or abuse that doesn't look like what, or they're not seen as a legitimate victim, those kinds of things. So I think the changing their perceptions will come, there needs to be a broader societal change. And I think for me, a big part of that is recognizing, specifically mentioning intimate partner sexual violence and other kinds of hidden forms of violence and abuse in policies. So when we've got a policy on intimate partner violence, recognizing it as a form of intimate partner violence, but also recognizing it having a unique context, and in sexual violence policies as well, because what's happening is people are working in really siloed ways. I think with the police, I mean, at least what I know of the police, sometimes when it's a domestic incident, they don't kind of see it as that serious. I think there can be a flag sometimes, so there's issues with that. But I think, yeah, a broader societal shift is needed, which I'm sure you're doing if you're working in a rape crisis centre and you're part of that work. But you can't, people can't be doing it on their own from the bottom. There needs to be a kind of top-down approach. So it needs to be recognised in policies. Like, for example, there's a serious violence policy from the Home Office, and it kind of hints at violence against women and girls, but then kind of refers to another policy. So it's kind of almost indicating that this kind of violence is not seen as a serious form of violence, when I don't think that's the intention, but that can happen. So yeah, bottom up, which you're already doing, and top down.
Thank you. And a related question. Unfortunately, there seems to be recurring themes from previous studies of violence and abuse, of women being silenced and blamed for intimate partner violence and abuse and intimate partner sexual abuse in one way or another. How do you think we can push for change with this?
Yeah, I agree with you there. That is a repeated theme. We know that women feel really silenced and blamed. I mean, I think what needs to happen is there needs to be we need to change hearts and minds, and mostly hearts. I think this is how we're going to find change. People need to feel a kind of an emotional response or a connection to how hugely unfair these experiences are, and how, and I think we can do that. I mean, research is one way to do that. Research often doesn't really get listened to for a very long time, if ever. But I think bringing survivors with us and creating, I don't know, like things like using art and other ways to communicate the impact of these experiences is so key. And often has a kind of quicker impact, I think, than research. But I think empathy is the way forward. I think often people just don't, and I'm not saying people don't have empathy, but they don't have an emotional response, because there's so much, it's so ingrained in our culture and our society to think that if somebody's experiencing violence or abuse in a relationship, that they can just easily kind of up and leave, or that it's their fault somehow, or that women, there's a lot of kind of pathologizing women in our society. So yeah, it's a big thing.
A question: how could we help service providers to recognise training needs in their staff? I have a feeling that sometimes assumptions can be made about what is known and where knowledge gaps might be or not.
So can you say that again? So training needs among staff in intimate.
How can we help service providers to recognise training needs in their staff?
Okay, that's a really good question. I'm not sure. I think so there's some interesting work actually that Laura did, where she looked at, I can share the paper if it's helpful, but they spoke to different mental health staff about kind of what they thought about responding to gender-based violence in their work. And they created kind of 3 typologies of people. So there was these, some staff members were really kind of interested and really wanted to help, but didn't know how. So they needed some training in terms of just understanding what gender-based violence is and how to respond and those kinds of things. Some staff were really knew a lot and were really motivated, but felt really constrained by the system. So they wanted to respond. And they knew how, but they didn't feel able to because of the system that they worked in. And then there were some providers who didn't see it as part of their work. So I wonder if that could be used as a frame and understanding. First and foremost, do people see it as part of their role and part of their response? Because sometimes people don't. When it's part of a public health response, it's a public health issue. Do they even see it as relevant? And do they know how to respond? That's another issue entirely. What are the kind of basic guidelines, things that they should be following? And then also, what are the systemic factors that are holding back those staff who are really motivated and really interested? So things like high staff turnover, short appointments, all those things that really prevent a proper response to this as well.
Thank you. In terms of the variation in response, did you find that some services were better at responding than others, or were there differences, for example, between male or female service providers? Did you see any patterns at all?
It's a really good question. No, there was just two small numbers for that. So most women didn't identify because they answered loads of questions about what service providers they had spoken to, etc. But in their response to those questions that we analysed, they didn't usually even mention what service providers they were talking about.
Mm-hmm.
They were kind of more broadly commenting on their service kind of help seeking experiences. There was a few mentions of things like therapists, so particularly around kind of couples therapy and therapists. That's something that stands out to me, was kind of therapists maybe assuming that there was a difference in kind of libido and trying to address that. So that did come out as one, but I'm not saying that's therapists doing a bad job. That's just kind of a specific example. I think that survivors gave a lot, and definitely the police came out a few times. But I feel like I can't really answer that because it was just so broad. But I'll link to the voices reports, because there might be something in there. They produce so many reports. There's like 5 or 6 of them on the kind of broader data, so it wouldn't be intimate partner sexual violence specifically.
Thank you. Going back to the point about the quote about the responses focusing on improving sexual drive when the woman is experiencing sexual coercion, were these types of service responses exclusively in medical settings, do you know, or were they coming out in other places too?
Oh no, I'm afraid, yeah, no, because it was just this is such a high level analysis. And what I should have mentioned is there's like basically nothing on this in terms of the research world. I mean, intimate partner sexual violence has been so ignored, and I know it hasn't been at all in practice, you know, in the third sector and stuff, but it has in research. So, you know, just having something is a starting point, but I would see this as a starting point and an invitation for further research, because I think those are really good questions that we need to find out. But if we think about kind of women being pathologized and things like that, that is there's a lot of literature on that in the medical kind of world as well. So.
Síofra, thank you so much for not only presenting so beautifully, but also taking such a wide range of questions from the attendees today. It's been fantastic to have your thoughts and your expertise on this topic. Just to say to everybody who's asking for the resources, absolutely, we'll be sharing the recording, we will be sharing the slides, and we will do a consolidated list with links to the resources that have been discussed today. So the paper, which reports in detail on what Síofra's been talking about today, those voices reports, and also the research on mental health providers and attitudes, which Síofra mentioned. We will be taking a break from our webinar programme for December, but we will be back in January when we will be having a webinar talking about domestic abuse related suicide, so another really important topic. So I hope many of you will be able to dial back in January to join us. But thank you so much for being with us today. It's been great to be online with you, and thank you again, Síofra. It's been fantastic to have you.
Thank you so much.
Everybody.